The story of this discovery starts with a freewheeling American trader called Edwin Smith. He spent much of his time trawling the markets of Luxor, hoping to discover ancient artifacts he could sell for an easy profit.
Edwin Smith was this remarkable American. He described himself as an American farmer of Luxor, and he was an individual that really went out to Egypt, not for the greater good of Egyptology, but really to find his own fortune in his own way. Most Egyptologists regard him as a bit of a bounder and a cad.
Usually, Smith was quite happy to buy a well-made fake, which he had few scruples about selling on as the genuine article. But he knew his business, and this papyrus looked genuine. Not only that, Smith could read hieroglyphs and could see that this was an ancient medical treatise, and therefore highly unusual.
It was quite clearly a sale from a tomb robbing, and Edwin Smith incredibly recognised how important it was and actually purchased it. Otherwise it could have ended up being burnt or destroyed and would have been lost to history.
Smith knew he could get good money for the papyrus, but uncharacteristically he had second thoughts. He realized its importance and for unknown reasons decided to keep it. It became a Smith family heirloom for more than 70 years. It was only when it was fully translated in the 1930s that its significance was recognized. The Edwin Smith papyrus is a detailed but incomplete compendium of surgical treatments for wounds. It starts with head injuries and works its way down the body.
Well, the Edwin Smith papyrus is without doubt the most crucial medical papyrus to come out of ancient Egypt. It's almost entirely devoid of using magica ritualism and religion in its treatment and its prognosis sections. So here we have a papyrus the modern doctor would recognize how it was set out.
Natasha is examining the text for evidence of particular surgical techniques, ones that could be of use to a plastic surgeon.
Can you tell me what kind of surgical procedures were described in this? I mean, how much detail did they go into it?
Well, Edwin Smith is wonderful because it goes into huge detail, describing each individual trauma, how you would look at that trauma, how you would diagnose it, how you would examine, and then how you would treat each trauma. If you take, for instance, case 10, here we see it starts as instructions for a gaping wound, and this is the hieroglyph of a pair of lips with spittle coming out of it.
Oh yeah, I see.
And then it said, thou shouldest draw together the gaping wound with idir. And we're pretty sure now it actually refers to stitching.
Oh, right.
Now, it is quite remarkable because what it's effectively saying is this is an injury which you shall stitch together.
So do you have any idea what kind of sutures were used? Did they give you any more detail about what materials were used or the type of needles?
Stitching was actually using acacia thorns and pieces of flax derived from various plants. So we have a reasonable idea of what we think they might have used.
Stitching cut or torn skin is at the heart of plastic surgery. It was the same skill needed if Nefertiti had wanted a permanent facelift.
Here's another interesting example. This is case 39 of the Edwin Smith papyrus, and what's clear is this is a fungating tumour, and if you look further on down here, the description of the case, that it is a tumour which is filled with pus. This is an ailment which I will treat, so the instructions to the ancient Egyptian doctor is this is something that can be treated. And this is where we come across quite an interesting and, without doubt, the first description in medical papyri of a particularly heat treatment. So this is the use of cauterization, a heated instrument, undoubtedly something of copper, which would not only cut away the necrotic tissue, the damaged tissue of the breast, but also something to seal all the blood vessels.
So otherwise the patient would bleed to death, would hemorrhage to death?
Absolutely, and the ancient Egyptian doctors really understood that and codified it in this particular medical text.
The Edwin Smith papyrus was fascinating because there are many different concepts of plastic surgery that I would have thought were modern innovations. For example, the firebrand, or coagulating bleeding blood vessels. We have that today in something called diathermy, which uses electric current to stop bleeding. I'm really surprised and pleasantly surprised that they had that concept of coagulation in the ancient world.
The papyrus, which is likely to be a copy of a much older text, dating from Carr's time, covers trauma treatment, not plastic surgery. But many of the skills are the same. Carr probably could have been a plastic surgeon, but would it have occurred to him?
I'm now going to go and see the royal mummies in the Cairo Museum to see if there's any evidence that they had any type of surgery, or especially plastic surgery. Now, if there was a luxury such as aesthetic or reconstructive surgery in those days, that's the first place I would go and look.
The great convenience in doing any kind of research on ancient Egypt is that you can always refer to the actual bodies of the people who lived then. So at the Cairo Museum, Natasha will be able to look at the world's best collection of mummies and see if there's any evidence that any of them ever had plastic surgery. She's met by Salima Ikram, a world expert on ancient Egyptian mummies.
Hello. Hi, I'm Natasha.
Salima.
So nice for you to meet me.
Salima takes Natasha to see the mummies in the royal chamber.
Here's the mummy of Ramses II, who's perhaps the best known pharaoh in all of Egypt, the great Ramses.
So he looks like quite a hawk.
Yes, he does. Come down here and look at the profile. See how his nose sticks up?
Yeah,
And
it's very prominent.
Very prominent, not like the rest of him.
Natasha is suspicious that the nose has survived so well for so long. Is it artificially enhanced? Is this the first nose job? In the same chamber, an ancient queen shows distinct signs of a facelift.
This is the mummy of Queen Najmet, and you can see that she has been very much enhanced.
She doesn't look as sunken as her cheeks don't look as sunken as the other mummies.
No, not at all. That's because she's been stuffed, and that's why her cheeks are all protruding. And in fact, over here, you can see where the substance in them has made the cheek bulge out in an unfortunate way, and it's exploded slightly.
There's a mysterious substance seeping out of the mummy's cheeks. Could it have anything to do with plastic surgery, or just with mummification?
You can see over here quite clearly what we were looking at upstairs.
Oh, this one, yeah.
Yeah, I want this one, please. Here. She's really filled up and padded,
right,
because you can't even see the bones. Some of it's resin, but the rest of it's this cheesy material. What's interesting, though, she wasn't just stuffed up there. She's also stuffed inside.
Right.
And in fact, she was stuffed with more bandages so that she had a nice little belly, because women are supposed to have a nice sort of rounded, curved belly.
So that's her tummy there, and that's all proud. It isn't the concave, scaphoid belly.
Obviously, bandages weren't stuffed into her belly while she was alive. But what about Ramses' nose?
Because it was his most recognizable feature, he seemed that he wanted to have this in the afterlife, so he made sure that the undertakers and the embalmers made him look like himself, so that he could be immediately recognizable. Here they put a little bone, probably a finger bone or something.
Yeah, that is very abnormal, yes.
And then there are all these little seeds.
And is that why all the other mummies have very sunken noses, because it wasn't stuffed? So even that would sink back into the face.
Because, I mean, Ramses II was very famous for his nose, because if you look at the statues, and if you look at his reliefs, you'll always see him with this wonderful, large nose.
Aristocratic nose, very proud.
Prominent, certainly.
Okay. So it's more his identity, so nobody would confuse him with a lowly Egyptian. He would always be the...
He could never be any other person but Ramses the Great.
Okay. Egyptians had this very novel approach of enhancing the facial features through implants, something that we do today. They were only hindered or limited by their lack of materials. We used very sophisticated plastic and silicone. They didn't have those materials available, so they were hindered not only by the surgical tools, but also the materials available.